When you think of hearts in February, you may be thinking of the little candy ones that have those messages. But February is also American Heart Month, and so there's no better time to start taking care of your cardiovascular health. Now, some risk factors for heart disease are common in both men and women, but some of those issues make heart disease even more dangerous in women. So here to tell us more from the University Hospital's Harrington Heart and Vascular Institute is interventional cardiologist Dr. Mito Mayuga. Thank you so much for joining us.
Thank you, Rachel. It's my pleasure.
First, tell us, how common is heart disease in women?
Heart disease is common in women. Approximately 1 in 3 women actually can develop heart disease in their lifetime.
And what is unique about heart disease in women?
Absolutely. Women physiologically have some differences compared with men. They can have smaller hearts with thinner walls. They can have finer blood vessels, and that can affect the physiology of how blood flows in the body and how heart attacks present in terms of symptoms.
Now, what should women know about some of those symptoms they may be experiencing?
So the most common symptom of a heart attack is chest pain. And we think of that as chest pressure, someone sitting on the chest. But women can have a lot of atypical symptoms as well. For example, tingling of the fingers or hands, sometimes jaw pain or neck pain. I've even had a patient who had a toothache, and that was actually the beginning of a heart attack.
That certainly is unique. Now, what is your role in preventing heart disease as an interventional cardiologist?
Actually, that is a great question, and you've hit the nail on the head. I'm actually a general cardiologist and an interventional cardiologist. So I actually take care of patients on both ends of the spectrum and everything in between. So as a general cardiologist, I focus a lot on prevention. Identifying patients who have higher risk for heart disease and prescribing medications, recommending lifestyle changes so that we can help prevent heart disease, heart attack down the line. And as an interventional cardiologist, I actually treat patients with heart attacks. So I'm on the preventive side as well as the cure side.
And what inspired you to follow this path in your career?
Absolutely. You know, both of my parents are physicians. My mom was a pediatrician, but my father actually was a cardiologist. He's retired now. But he really inspired me to take care of patients who have heart disease. He actually had to retire after having a stroke. And so personally, I do feel a very strong goal in trying to help prevent heart attack and stroke in both men and women.
I'm so sorry to hear that about your father, and it's wonderful to hear how you took his story and made it your own to help others. Now, speaking of helping others, what are the benefits of catching heart or vascular disease early?
So the earlier we can catch the disease, I think the better we'll do down the line. I often tell my patients that what we're doing today actually matters 10 years, 20 years down the line. For example, quitting smoking or losing weight and getting more healthy. All of these lifestyle changes will pay dividends down the line.
Now, where should women start first if they are listening to you and they want to take action in their cardio or vascular health?
Absolutely. So oftentimes the first place to start is their primary care physician. So if they just want to get checked out, to do some screening for conditions like high blood pressure, high cholesterol, and even coronary artery disease and blockages, they can go to their primary physician, and that doctor can then order certain tests that can identify people at higher risk and then start treatment. Then, if they really believe this patient needs to be seen by a specialist, they can refer patients to a cardiologist. At UH, we actually have a Women's Cardiovascular Institute that is specific for women who need, the special care, and patients who have, certain symptoms that may be actually underdiagnosed. Women tend to be very caring for other people and may not always focus on their own health. So I think this Women's Cardiovascular Center is just a great place for women to be referred, where we can listen and help them to navigate this actually very complex condition of coronary disease and cardiovascular disease.
Well, we will be wearing red every February in promotion of American Heart Month. So thank you, doctor, for being here and telling us how important it is to not wait another heartbeat to start taking care of your heart and vascular health.